Perfect. Welcome. I am here today with Dr. Katharine Smart, who is the former president, past president of the Canadian Medical Association. Yay, you're here, and is also a pediatrician here in the Yukon. So welcome, Katharine.
Thanks for having me back. It's great to see you.
It's good to see you. It's been quite a year as the president of CMA, and we're very proud of the representation that you made in Canada, and I think globally, for not just the Yukon, but female pediatricians in Canada. So thank you.
Thank you. Thank you.
And I know there's a lot of thanks from the families that you support through the Council of Yukon First Nations Family Preservation Unit. So big thanks for all of the work that you do with First Nation families as well.
Oh, thank you. We feel very privileged to partner with CYFN and get to work with all the different citizens in the Yukon. So thank you.
It's fantastic. So we're going to jump right in. We're recording this on Monday, December 5th, and wanted to get an opportunity to have some discussion with you about the spike in cases of all respiratory illnesses that we're seeing and how much it is impacting children in Canada and in the Yukon as well. So maybe just cover your experience lately on how this respiratory illness is affecting health centers in Canada and Yukon, and is this any different than we've seen in previous years?
Yeah, thank you. Such an important question. So absolutely, it's different than what we've seen in previous years, and it's different in a few ways. One is just the sheer volume of kids that are all getting sick at the same time. It's a lot higher numbers than what we would typically see. And we're sort of seeing, people are hearing this term like tridemic. It's really like influenza, respiratory syncytial virus, and COVID, in addition to actually several other viruses, all happening kind of at the same time. And we've got three cohorts of kids who don't have sort of the same exposure to these diseases as they might have typically had because of the very important and appropriate public health precautions. But that's meant we've kind of got three cohorts of kids all getting sick at the same time. And what that's led to is just huge numbers of kids seeking care in emergency departments. I think in the news, people have seen a lot about the children's hospitals, but we're seeing that same thing here in Whitehorse with, tons of absenteeism from school with kids off sick, a lot more visits to the emergency department, and more admissions to hospital of kids that are ill. So it's absolutely having a local impact also.
Yeah, is it because it's more severe? Is flu or RSV that we're seeing right now, is it more severe than in previous years?
Yeah, great question. I think it's hard to know for sure because we've got kind of, two issues. One is that denominator is a lot larger than normal because we've got three kind of cohorts of kids. So the number of kids getting sick at the same time is larger than what's typical. So, proportionately, are kids sicker than typical, or is it just that more of them are getting sick at the same time? I don't think we have enough data to totally understand that. But what's clear, certainly with influenza, is it's like a vertical spike right now happening across the country in terms of numbers of people getting it, including children, which has meant we're way beyond the typical number of hospitalizations for flu for this early in the season. So again, is it more severe? Is it a numbers issue? Not entirely clear. In terms of RSV, I think it's sort of similar. We definitely notice in pediatrics year to year, RSV can be better or worse just in terms of the severity. It does, like a lot of viruses, sort of mutate and change over time. But again, we've got three cohorts of kids who haven't really had exposure. Most kids, 90% of kids will have had RSV at least once by the time they're 2. But we're not really seeing that with our current group of children. So absolutely more of them are getting ill, because what we know with RSV is as you get it multiple times, the degree of illness tends to lessen. So we're seeing a lot of kids with their first infection, which is often the worst infection. And RSV is a really serious virus in young kids. It's the leading cause of hospitalization for kids under 12 months of age. So it's a dangerous virus in young children for sure. So I think it's a combination of both those things. I think we'll understand better, were these versions of these viruses more severe than typical, probably in a few months when we have more data.
Mm-hmm. Could you just talk about the difference in how flu, RSV, and COVID as well, how they present differently and the treatments for each?
Yeah, thank you. So I think the first thing that's really important to know is both flu and COVID have a very effective vaccine. So, always prevention is your best option. So if you can prevent getting really sick, that's choice number one. And we know the uptake for both those vaccines in the Yukon is much lower than what would be ideal. So I'd really encourage people, if you haven't had your child vaccinated for the flu or COVID, now is a great time to go ahead with that. And both vaccines are available for children 6 months and older. So that's kind of number one. Number two, in terms of what they look like, for all three of those viruses, they can all really look very similar to each other, and in some ways different. So what do they have in common? All of them can cause fever, various heights of fever. So any virus can give you a really high temperature, like 40 degrees, or a mild fever. They can all cause upper respiratory tract infection symptoms like runny nose, cough, sore throat. But they can also cause lower respiratory tract infections, which is when the virus gets down into the lung. And there it can cause something called bronchiolitis, where we see kind of wheezing and difficulty breathing. That tends to be in younger children. And that can happen again with all three of those viruses. But the classic one for that is RSV. And it can also cause pneumonia, and that can be viral, and it can predispose you to bacterial pneumonia. And that can also happen with any of those viruses. And then with influenza, we can also see some gastrointestinal symptoms like vomiting or diarrhea, which would be less typical with RSV, but can also happen with COVID. So the bottom line is, all of these viruses can really look much the same. And in an individual child, you can get a whole range of symptoms, from very mild illness to really severe illness needing hospitalization. And I think what's tricky is there's no kind of one symptom that would make you know for sure if it was one versus the other. The treatment wise, the only of those three viruses, the only one that we really have a treatment for is influenza. There is a medication, the brand name for it is Tamiflu, that we can give that can help with severe disease. There's no actual drug treatment for children for RSV or COVID. Most of the treatment, however, though, for all three of those viruses is supportive care, meaning fluids, oxygen if needed, and then of course monitoring for any secondary bacterial infections, because anytime you've had a significant viral illness, you're more at risk of invasive bacterial infections as well. And people may have been hearing a little bit about that in the news, especially invasive group A strep has been back in the headlines. And that's a bacteria that can sometimes happen after a viral illness. And again, it's when your immune system's sort of been busy fighting one thing, it's more susceptible to that bacterial infection. And that, of course, would be treated with antibiotics. So, our job as physicians is to try to tease all these things apart. And depending on the child, their underlying medical conditions, how unwell they are, what we do would to support that child through the illness would vary. But again, prevention is really important. Vaccination, masking in indoor spaces, and staying home when you're sick and avoiding other people who are unwell are ways that you can help try to avoid getting these things in the first place.
All the things that we've learned over the past 2-3 years, COVID feels like
that's right.
Just on the Tamiflu, if parents are seeking treatment for their child, what's the importance of timing with Tamiflu?
Yeah, so if your child has influenza, ideally you want to get Tamiflu early in the course of the illness. And it's most important in younger children, because kids under 5, and especially kids under 2, are the ones that are most at risk of having bad outcomes from influenza, and also children with any underlying medical conditions. So the Tamiflu can decrease your chance of having severe outcomes or needing hospitalization. And if your child is hospitalized with the flu, it can shorten the duration of hospitalization. It's most impactful if given in the first 24 hours, still up to 48 hours. And even after that, we may give it depending what's going on. But it is like most antivirals, it works best when it's given early. So if you're concerned about your child, it's a good thing to get them seen and ask that question, is there a role for Tamiflu? But even a better decision is make sure they're vaccinated for influenza.
That's great. And I think our latest numbers are around 21% of the population in the Yukon that has been vaccinated for flu, and about 22% for COVID. So is that enough?
No.
Yeah, I think there's a lot of families that have sick kids right now. It's going through a lot of households, and it's not nice. Are there other patterns that you're seeing, like if you're seeing vaccine hesitancy in your clinical practice, or there are other observations around why hesitancy is persisting?
Yeah, great question. I think like so many things right now, I think a lot of people are really tired. Like we've been through the pandemic, we're like 3 years in kind of now. I think everyone's like really tired. And I think unfortunately what we saw a lot through the pandemic is just increasing misinformation around vaccination. And I think misinformation fuels hesitancy. And in my experience, I think most families fall under that category of hesitancy more than being really anti-vaccine. But what I mean by that, they're not, necessarily believing that vaccines are super dangerous or bad, or a lot of those kind of conspiracy theories that are out there. But there's just, hearing those things has just planted enough doubt in the family's mind that maybe they haven't quite made a decision. And I find I meet a lot of families that are in that space, sort of like, oh, we're not sure we're against it, but we're not confident enough either to get the vaccine. And that leads to delay. And right now, of course, with influenza literally on a vertical rise in our country, that's meant that only, like you've said, in the Yukon, 1 in 5 people are vaccinated when this is sweeping through our communities. So I think it's really important for people to know, like, especially this year, the flu vaccine that's been produced is a perfect match to what's circulating around. So it's working really well. So it's a great chance to get it. If your child's afraid of needles, there's a nasal vaccine for the flu. So that's a really nice option. So, you don't even have to worry about needle phobia in this particular case. So that's a great option. And the flu vaccine is very safe and effective. And it really does reduce the chance of your child getting severely ill and needing to be hospitalized. So getting your family vaccinated, I think, is a really good choice. But I certainly understand, why for some people, I think they're not always sure what to do. But I would make a really strong recommendation. And I always say, walk the talk. I'm fully vaccinated for the flu. Both my children have had their vaccines. We get our vaccines for the flu every year. And it's a really great thing you can do to protect yourself and other people you care about, because there may be people in your circle that are even more vulnerable to the flu. So again, I think a lot of these decisions are about protecting yourself, but also about that community action.
And I think there has been a lot of misinformation, or just not enough information getting out there, because I've had some conversations with individuals who didn't realize that their children were eligible for the vaccine, either COVID or flu. So it's very helpful to have the conversation. So very much.
Yeah, absolutely. And like I said before, 6 months and up for both vaccines now. So it's absolutely available both for COVID and influenza, and 6 months and older. So absolutely a great time to choose to be vaccinated is today.
Our tagline is "Vax to the max."
Absolutely. Yes. Yeah. I'm with you on
that. I do have to put in a plug for the nasal spray. My teenager is loved that he did not have to get a needle. He could use the nasal spray.
Yeah, I think it's just great for people to know that's an option, right? Because I do understand, like, for a lot, no one likes a needle, but some kids are really afraid, and that having the flu mist up the nose option is just a really nice choice.
I do want to circle back. I know I've had a lot of conversations with families that are outside of the Whitehorse area, and they're about a 2-hour to a 3-hour or 4-hour drive away from Whitehorse. If they have a sick child, when should they be seeking medical advice or medical intervention?
Yeah, great question. And I think that's really a hard one for parents, right? Because right now so many kids are sick. And I think a lot of parents wonder that, like, when do I worry, right? So I'd say there's a few situations where you want to be concerned. There's really kind of 4. So the first is, if you have a child 3 months or under who has a fever, they really do need to be assessed by a medical professional, because the risk of bacterial infections or serious infections in that age group is higher. And some of these viruses we've been talking about in younger babies can also be a lot more serious. So if you have a young infant who's febrile or showing signs of an infectious disease, definitely have your child looked at. The other times in older kids where we worry, there's a few different situations. So one is really respiratory distress. So like we were talking about, all of these viruses can get in the lungs, can cause difficulty breathing. And if your child's struggling to breathe, absolutely want to be seen. So what would signs of that be? It could be fast breathing, sucking in between the ribs. So either below, in between, or up high, or trachea tugging. We call that work breathing. So I think all of us know, like, normally when you look at your child, it's kind of imperceptible that they're breathing. if they're sick with something in the lung, you're going to see them really kind of working. That would be a sign to seek care. If they're off color at all, so any of those signs are really an emergency. You want to go to your health center and be seen by one of the nurses. So if needed, oxygen can be started, and your child stabilized, and then a plan for there can be made. So that's one. Another one would be signs of dehydration. So that would look like dry mucous membranes. When you look in the mouth, it's not wet, it's dry, not making tears when they cry, starting to get sleepy and lethargic, not interested in drinking, and maybe less peeing. So, normally you should be peeing at least every 6 to 8 hours. If that's changing, those would be signs to seek care as well. And then in terms of fever, which is a really common reason people seek care. So fever in general is not dangerous for kids. It's a way the body fights viral illnesses, and it's usually self-limited. And the number itself isn't dangerous, but fever can also, of course, be a sign of more serious infections. So, when should you worry? So fever that's gone on for more than 5 to 7 days warrants a checkup, because there may be something new going on. And like we were talking about earlier, having a viral illness can sometimes put you more at risk of a secondary bacterial illness that often shows up as a prolonged fever. So that would be a time to have your child looked at. Fever can also be a sign of more significant infections. So what would that look like? That's a child who's just not responding normally to their environment. So if you have a child who's really sleepy and you're just not able to get them to perk up and respond normally to you, and that would be a time that you'd want to seek medical attention, because that could be a sign that they're more unwell. That can sometimes be combined with the breathing difficulty, with dehydration, or some of the infections that happen around the brain can just present with a child who's really, really sleepy. So what I often say to parents, when the fever is high, often your child will look unwell, it comes down, usually they perk up, look a little bit better. Usually they can be consoled, you can get them interested in playing a little bit, eating and drinking. As long as you're having those ups and downs, that's okay. But if you're like in the valley and your child's really not perking up, not responding normally to you or the environment, then that's a time that you really want to make sure that your child's getting seen so they can be assessed for something more serious. So those are really the times I think that you want to seek care. And the other thing I would just say is, I think parents know their children well. If your just gut feeling is like you're concerned, there's for whatever reason, just the way your child looks to you, the way they're behaving, you don't think it seems okay, and it doesn't seem to be turning that corner, we would absolutely want to see your child. I would much rather children be seen and assessed, and if they're okay, that's great, than for parents to be sitting home worrying or perhaps missing something more significant because they didn't feel comfortable about seeking care. So also trust your instinct as a parent. That's also a really important piece of this.
And I just wanted to touch on, I know there's been in the news a lot lately about the shortage of ibuprofen or Tylenol or aspirin or any sort of treatment for kids. We've just been notified that there is a supply here in the Yukon and that it is at the pharmacies. And I just wanted to get your opinion on where or when that should be administered and what shouldn't be administered or how.
Yeah, important question. So as you mentioned, there's sort of 3 main fever reducers. Aspirin or ASA is the one we don't want to give in children, especially right now, because when you combine aspirin and the flu in kids, it can cause problems with the liver. So aspirin is not a drug we ever use to treat fever in kids. Both acetaminophen or Tylenol or ibuprofen, Advil are safe to use in children as fever reducers. But I think what's important with the message there is that the reason we treat fever is for comfort. So the fever itself is not dangerous. There's not a particular number where it's going to cause brain damage or harm your child. A lot of parents worry about that. But as we all know, when your child has a high fever, they don't feel well. They look lethargic. Sometimes they don't want to eat and drink, and they can just be really uncomfortable. So that's the reason we're wanting to treat is for their comfort, to make them feel better. I think the reason they're keeping the medications right now behind the counter is just to ensure that there's enough supply for everyone. So you can talk to your pharmacist and get access to those fever reducing medications that way. There's different formulations. There's an infant formulation, the child formulation. If you have older children, they can often swallow pills. So that's an option. All those drugs are dosed based on weight. So if you're not sure about that, that's a great question to ask the pharmacist when you're purchasing the medication, and they can help you with what the appropriate dose is for your child.
And if you are in the community, we're sure that the nursing stations have children's Tylenol or Advil, children's Advil for.
Yeah, another great resource. And again, if you're not sure of the dose, the nurse there would be able to help you with that as well.
Fabulous. I think that's it. Oh, I wanted to ask you, I saw you on your social media and I saw you wearing a mask on the red carpet. Is that something that you're encouraging people to do, or yeah.
Yeah, great question. So, again, I think a lot of people are wondering, like, what can we do right now? We're hearing a lot about the viral surge, a lot of people being sick, what are actions we can take as community members? And, I think one of the things we've learned through the pandemic is that masking during viral surges is an effective way to protect people. And right now we're encouraging people to mask indoors because we're seeing such a surge of viral illnesses in communities. And of course, this really dramatic impact on children. So I try to wear my mask as much as I can when I'm in indoor crowded spaces. And I would encourage people to consider that. It's something that can be very helpful. And of course, the other things that are helpful are staying home if you're sick, making sure you're washing your hands. That's particularly important for RSV and the flu, and staying up to date with your vaccines. So I think the more we can have collective action around the things that each of us can do, and if we each do those little things, it adds up to more protection for our communities.
Yeah, it's true. It is a bit of a culture shift. Hey, when we think of a lot of Japanese families, they just know this, you wear a mask if you're not feeling well, or you stay home. Yeah, it's that.
No, I agree. It's a
Yeah.
big change, right? And I think when you look around right now in Canada, you can see it's not something that's maybe like grasped the hearts and minds of Canadians, right? You're not seeing a lot of people masking. And I think it is because culturally, as you said, it's just not something we've really done before. And then I think, again, people are tired. The pandemic's been long, and I think people are wanting those freedoms. So what I'm really hoping people can consider is what I like to call kind of pragmatic masking, right? I get it. I don't love wearing masks either. We don't want to wear them all the time, but there's certain settings where they can be really helpful. If you're going in and out of the grocery store, throw on your mask, right? If you're on an airplane, if you're in a crowded indoor setting, throw on your mask. And if we can all be doing that, it's not perfect, but it absolutely can decrease the spread of these infections, sort of keep it a bit more mitigated. I think that's what we want to be working towards, not the expectation that people wear masks all the time, not that you can't see your friends and family, not that you can never go to a restaurant, but let's try to wear a mask in certain settings like those ones, those indoor really crowded spaces, and kind of, if we each do a little bit, it kind of can add up to bringing those numbers down and allow our healthcare system to cope better.
Yeah, and I think that's a really good way to close out, is just a big thank you to yourself and to the other healthcare workers that are keeping us safe. And really, it's overwhelming. So if we can all do our part, I think that's a big piece. Thank you so much.
Yeah. Thank you. I always appreciate the conversations. And also thanks to you for all your advocacy work and making sure people have good information. I think it's really one of the big challenges right now.
Yes, thank you. Thanks, Tish. Yes.